Today, this event, Tea with a Scholar, is an event that we host once a term, the beginning of every term, and it's hosted by our Pi Theta Epsilon group. Pi Theta Epsilon is a national honor society for occupational therapy, and we're fortunate at USA to have a chapter, the Delta Kappa chapter, that we host here. It's a second term honor society, and so eligible students are invited in their second year to apply. The goal of PTE is to support scholarship and leadership within our profession, and the students are required as a part of their services to the school as members of Pi Theta Epsilon to host a scholarly event of some type. And so the Tea with a Scholar is our way of providing a scholarly opportunity for students through the actions of your Pi Theta Epsilon leaders. So today we have a very special guest, as you all have been made very well aware of. And our current Pi Theta Epsilon president, Tara Toombs, is going to do the honors of introducing our guest.
Welcome all to the Fall 2017 Pi Theta Epsilon Tea with the Scholar. We are honored in this, okay, thank you. Where was I? Let's see. We are honored in this centennial year of occupational therapy to be joined by one of the most influential OTs of all time. Dr. Lela Llorens is well known for her rich history of contributions as a clinician, scholar, educator, and administrator in occupational therapy. In her 1969 Eleanor Clarke Slagle Lecture, she presented a theory of occupational therapy based on human development, noting its influence on the neurophysiological, physical, psychosocial, and psychodynamic aspects of development. Dr. Llorens chaired AOTA's Research Advisory Council in the mid-1980s, where she advocated for establishing doctoral level degrees and the value of both qualitative and quantitative methodologies. She has received many prestigious awards for her scholarship and leadership in the field of occupational therapy. So please join me in welcoming Dr. Lela Llorens to the University of St. Augustine.
Thank you, Tara. Thank you, Dr. Schreier. Thank you both for welcoming me and for the lovely introduction. And to Jessica Bosick, whom I haven't met, who was the first person to contact me, and my thanks to her as well. It is a pleasure to be here, and I want to give you a little trivia to begin. My middle name is Augustine. Yes! Yeah, you'll see Lela Llorens on a lot of my papers, and that's what the A stands for. In preparation for this morning's presentation, I've had the opportunity to review the very astute questions that some of you have submitted, and possibly faculty as well. And I've embedded answers to some of these questions in my presentation. Our plan is to have some time following my remarks for you to ask other questions. I chose the title, Engaging in Occupations, a 100-Year Legacy, because we as occupational therapists have used activity and occupations along with empathy, intelligence, compassion, and understanding in our many roles to help people, to help them to achieve a new way of being following accidents and injuries, those with birth defects, and others with mental health issues, as well as numerous other conditions. In so doing, our intervention is intended to habilitate and rehabilitate body, mind, and spirit toward achieving a satisfying lifestyle. I will begin by reflecting on my journey in learning the value of occupational therapy as I have lived it. I came to occupational therapy in 1949, which to many of you must seem like the dark ages. I came to occupational therapy without knowing exactly what occupational therapy was or what occupational therapists did. I soon learned that being able to articulate what occupational therapy is was more difficult than knowing in one's heart, mind, and spirit. I came to know occupational therapy first through the curriculum at the College of Puget Sound, now University of Puget Sound, in Tacoma, Washington, where I was living at the time. Attending Puget Sound was by happenstance because I was living there, and by options, and my options at that time were limited to my local area. I chose occupational therapy as a major because the curriculum resonated with my interests. In those days, the curriculum consisted of part science and part arts and crafts. In high school, my curiosity was excited by scientific projects, and my interest in crafts had been nurtured since childhood. I learned to knit when I was about 6 years old, to sew on a treadle sewing machine as soon as my feet could reach the treadle, to enjoy kitchen crafts with my grandmother, and hand sewing as a Girl Scout. We made wound pads for cancer patients. I grew vegetables in our World War II Victory Garden, and these activities helped to keep our idle hands and minds busy. Idle minds, according to my great-grandmother, are the devil's workshop. When I came to occupational therapy in 1949, mental and physical activity were central to the establishment of rapport with patients and to their development of skill and ability to cope with and overcome illness and disability. I think this is a core value in occupational therapy and continues to prevail. At that time, I embraced this principle and soon learned the meaning and use of activity for treatment and rehabilitation of children with cerebral palsy and adults with psychiatric conditions. I continued to enjoy the curriculum, and on commencement of student affiliations, now called internships, I learned to put the knowledge and skills that I had acquired to good use. It was then that I began to discover that while those of us who felt called to this work knew that it was valuable, others did not always recognize its value. It was very difficult to explain its value in words. As I moved from internship into practice in 1953, I was fortunate in my work with mentally ill patients and to have the freedom to actually practice according to the ideals that I had internalized as a student in occupational therapy. I was a student at Western Michigan College, which is now university, where Ms. Marion R. Spear accepted me as a transfer student from the College of Puget Sound. I was in my second year. The directors of these two programs at Puget Sound and at Western Michigan shaped my view of occupational therapy. These women were true believers and brought a sense of mission to the profession. They instilled a sense of dedication in us as students. More questions than answers. At this point, I had more questions than answers, but for sure my practice with a patient always began at the level at which the patient could succeed and was gradually increased to provide the rehabilitation needed. As I gained more experience, my interest in being able to explain clearly the value of occupational therapy increased. My first position at Wayne County General Hospital in Eloise, Michigan, gave me the opportunity to work with people with mental health problems. Most were adults whom we could assist to be more productive. And in those days, the products of their activity were in fact sold, and some of the funds were provided to the patients for their use. Although the patient population was primarily adult, children were occasionally admitted when there were no other alternatives for them. My encounter with an angry, out-of-control child in this otherwise adult environment heightened my interest into how occupational therapy could help a child dissipate anger and learn to control his behavior. Through the use of clay wedging, throwing, and shaping, we made considerable progress. This was heartening to me, and I was beginning to answer my question about what occupational therapy could do. When the opportunity arose to work with more children with mental health and behavior problems, I moved to a position at Northville State Hospital in Northville, Michigan, and continued to work with the belief, knowledge, and dedication imparted by my earliest role models. As children with mental health problems became a major focus of my work, the Lafayette Clinic in Detroit beckoned. There, I had the opportunity to work in an environment that embraced treatment and research. During that time, as I practiced at Lafayette Clinic, I was pursuing a master's degree in vocational rehabilitation at Wayne State University. There, I was introduced to the scientific method. I also became a part of a research team. This team was made up of professionals who were interested in questions concerning the treatment of children with mental health problems. Lafayette Clinic was a place where questioning was encouraged. That fed my curiosity, and resources were provided to assist in the quest for answers. During this period, I added research and writing for publication to my work as a therapist. My belief in our work was reinforced with every instance of a child showing ability to achieve goals, gain control of behavior, express emotions appropriately, and learn new skills. Occupational therapy was one of several disciplines that contributed to the treatment and rehabilitation planning, as well as procedures for each child. Our specific contribution could not always be discerned individually, even though we began to think we knew more about the answer regarding the essence of occupational therapy. Occupational therapy involves process and product. It embodies art and science. It encompasses many facets of human experience. It engages body, mind, and spirit. Following my years at the Lafayette Clinic, my journey led to accepting a position with the Mount Zion Hospital Medical Center Comprehensive Child Care Project in San Francisco. Work on the Comprehensive Child Care Project permitted me to create small demonstration projects. These projects were designed to further determine the meaning and value of occupational therapy. This time, with infants, toddlers, children, adolescents, and adults in a general medical setting. My reasoning was that given the reasonable successes that we achieved with the children whom we saw as emotionally disturbed at 5 and 6 years of age, might we be able to prevent the problems that we observed if we could intervene earlier in their lives? The question continued to reverberate, but now in the form of how can we articulate the meaning of occupational therapy? In my efforts to demonstrate the effectiveness of occupational therapy and to answer the question, I initiated programs to screen infants and children in the Well Child Clinic, to evaluate and provide services for infants and children on the inpatient pediatric service, developed and provided services for teenage pregnant girls, consulted with teachers of children with learning disabilities as outreach to the community, and to preschools in our catchment area in San Francisco. I also provided consultation to colleagues on the adult psychiatric and mental health services. Ms. Wilma L. West, whose name I'm sure you're familiar, it was her vision of health services for children which was quite instrumental in my work on the Comprehensive Child Care Project. Wilma West, by the way, was one of my mentors. Belief theory and affirmation. It was during this period in the late 60s, in response to the award of the Eleanor Clarke Slagle Lectureship, that I conceptualized facilitating growth and development, the promise of occupational therapy. It emanated from my personal professional belief system that related to the value of activity and the professional principles of occupational therapy. These I had internalized over my years of practice. The answer to my question was expressed in a developmental theoretical perspective. It was my belief that the results of occupational therapy could be recognized through expression of emotions and in behavior performance, facilitated by activities and occupations. When the desired emotions, behavior, and performance were adaptive, our work was reinforced and we could observe the value and meaning of the work. One of the questions sent to me asked about my favorite client or favorite moment during my career. I spoke about Louis earlier, the angry child with out-of-control behavior. Louis was my first child patient. Bobby was my last. These two children bookended the practice part of my career. Bobby was 9.5 years old and considered hyperactive. At that time, we were not using the term attention deficit disorder, but today that would likely be his diagnosis. My work with Bobby occurred in an elementary school in Gainesville, Florida. You must wonder, I've been all over the country. It's true. Occupational therapy was the only therapy being offered in this setting at the time. I could offer the therapy as a consultant because the University of Florida permitted the occupational therapist 1 day a week to provide services gratis to the community. We were unable to achieve a complete evaluation of Bobby initially because of his inability to remain focused and to sit in a seat long enough to perform tasks. Bobby's occupational goals were to 1, run and slide, 2, throw and catch a ball with his grandfather, for whom this was a measure of being a boy, and 3, sit straight in his seat in the classroom without falling over or sitting sideways. Evaluation suggested developmental dysfunction at the sensory motor level. His program included sensory motor activities to stimulate or inhibit sensory systems, increase muscle strength, motor coordination, increase ability and skill, trunk stability, appropriate weight gain, motor coordination, and balance in sensory systems. Most importantly, his occupational goals were met. He was able to run and slide, to throw and catch, and to sit in his seat appropriately in the classroom. His mother reported that he had transformed from a frail, frightened child to an appropriately muscular little boy with improved social interaction. He no longer shied away from lining up for activities as he had earlier when he could not tolerate light touch. All activities used in therapy were facilitative or inhibitory, and at no time were his target goal occupations practiced in therapy. It was only when Bobby went to visit his grandfather and returned with a big grin to report that he could throw and catch, run and slide, and that his grandfather was proud of him did we know for sure that he had accomplished his occupational goals. This was one case that clinched it for me. I was convinced, as I could not be when working on a team, that occupational therapy could, in isolation, provide the therapy outcomes that would lead to joy and satisfaction in one's everyday occupations. It reinforced my belief in the value of occupation. While the concept growth and development is often associated with children, it is and was my contention at that time that occupational therapy has the ability to facilitate growth and development at any age. This was presented in my Eleanor Clarke Slagle Lecture in 1970 and further discussed in a little book entitled Application of a Developmental Theory for Health and Rehabilitation, published in 1976. Further discussion and applicability of the theory has been presented in several editions of Occupational Therapy for Children, Occupational Therapy, Overcoming Human Performance Deficits, this volume by Christensen and Baum, and most recently in a book by Dr. Len LaCourte entitled New and Expanded Neuropsychosocial Concepts Complementary to Llorens Developmental Theory. Occupation and aging. Now, moving on to more specific questions sent to me regarding mentoring, retirement, and how my occupations have changed since. I would say first that teaching students and mentoring young colleagues are extensions of who I am as an occupational therapist. Although retired from practice and from academia, one must remember that our life occupations continue. The balance of occupations may shift from work to leisure. My leisure activities include crafting, quilting, gardening, sewing, memoir writing, nurturing friendships, mentoring, community service, and helping others. And I wonder how I ever had time to work. Mentoring one's colleagues is an honor. To the question of what I find most rewarding about mentoring, I think it is observing the growth that is inspired by the support, the responses to questioning rather than providing answers, and witnessing the results of the process of mentoring, which may be improved practice, academic commencement, achievement of a position, acceptance into the OT program of her choice, just to name a few. It is important to pass along the philosophical beliefs, particularly as we become more scientific. Now to some of the other questions. One, regarding balancing support for learning, self-care, and quality of life when I was in OT school. Well, OT school was as challenging for me as it probably is for you. We attempted to find balance as students, engaging, of course, in attending classes. Some of us by working. I worked as a salad server in our dormitory dining room, attending dances, participating in the Occupational Therapy Club. I was on the program committee and received mentoring from one of my professors, attending church services, and volunteering for community service. There was no Pi Theta Epsilon in those days, and to you I would say, do everything you can to find creative solutions for balance, even when you feel overwhelmed. Take time for leisure occupations and remember, fun. F-U-N are the first few letters in function. You need it in your life. Another question asked about a population that could use our services, but has not had OT involvement as yet. Although there is some involvement, and it is quite possible there are some programs that are reaching this population, I would urge occupational therapists to find ways to provide services to addictive populations, particularly those addicted to opiates. The population is exploding, and the conditions affect all ages, beginning with infants of addicted pregnant mothers, children 12 to 17, young adults, adult men and women, older adults 50 and over, and many veterans and military service members. Treatment and rehabilitation will include neurological issues, mental health issues, and physical disabilities that stem from falls, from other accidents, and the like. Ask about my best advice to aspiring young therapists. I would say select positions in which you think you can make a meaningful difference. Unless salary is the most critical factor, choose to work with client populations for which you have passion. When you discover your passion and work in that area, you will enjoy every day of your career. Regarding this, one question asked what I found most difficult in establishing myself as a reputable occupational therapist. I can honestly say I know of nothing. However, the competition in those days was probably not as fierce as it is today. You've heard earlier how I rather easily moved from one position to another as I began my career until getting to the place I wanted to be. The personal qualities, in answer to another question, that I think are helpful in being successful as an OT are curiosity and creativity. I think these have been two of the keys to my success. Being willing to think outside the norm and being willing to work with professionals in other disciplines to share knowledge and learn from each other have also contributed. For our male counterparts, the question of advice for male practitioners, I would say be gentle in your approach and practice with consummate skill. That means knowing what you're doing and being able to communicate effectively with your clients and your colleagues. But that goes for all OTs. Think of yourself as a practitioner and not as a male practitioner. behave as you would with any of your clients. On the occasion when you are mistaken for the physician because you are male, handle it with humor. Some of the advice I just mentioned I have given myself. Regarding being an African American woman, one question asked whether how this has affected my career as an occupational therapist, positively or negatively. First, I must say that my sister and I were advised by our family to realize that we could be and could do anything we chose to do or be if we were willing to work hard enough, and recognize that we might have to work 110% to be considered good enough. Being an African American woman, and throw in another designation of a minority, I'm also Roman Catholic. I can honestly say that none has impacted my career particularly negatively or positively to my knowledge. I believe that it's been a combination of hard work and being prepared for opportunities that presented themselves. For instance, I had a master's degree long before it was required. When the position on the Comprehensive Child Care Project became available, it required an occupational therapist with a master's degree. I have tried to be prepared for any position that I think I might want before it became available. There is an ethnic story which I think would be of interest to you regarding race and prejudice. In the 1960s, I had been appointed as a representative to what was then called the Student Affiliation Committee. It was a national committee of the American Occupational Therapy Association. I think it's ASCOTA now. I was the first Black person to be appointed to a national committee, and the association had no experience with scheduling conferences where there were legal restrictions against whites and Blacks convening in the same room for a meeting in a hotel. This became an issue for a conference scheduled in New Orleans, Louisiana. Officers of the association were outraged. I offered to stay at the YWCA and take a sack lunch to fulfill my obligation, but the state law prohibited my sitting in the same room with my colleagues. The American Occupational Therapy Association, of course, went on record immediately as never, ever scheduling another meeting in such a venue. The association also prevailed upon the American Psychiatric Association and the American Psychological Association to do the same. This might be an appropriate place to answer the question regarding the recognition and awards that I have received and which was the most meaningful. I have already mentioned the award of the Eleanor Clarke Slagle Lecture. The award of the Eleanor Clarke Slagle Lectureship was very meaningful because it is the highest academic award offered by the profession. It was very special, but it was the first of the three that I consider the most meaningful. The second was the Award of Merit, which was a significant acknowledgement of professional achievement bestowed by my colleagues. The third was the American Occupational Therapy Association, American Occupational Therapy Foundation President's Award in the name of Wilma L. West. This was awarded in recognition of my contributions to the academic, practice, and research areas of the profession. They are a trio that I feel highlighted my career. They were presented in 1969, 1986, and 1997, respectively. To close this portion, I would like to say that I believe the core values of occupational therapy have stood the test of time, 100 years. Thank you.